Hi, today we are going to see about another postnatal abnormality or another abnormalities of the puerperium, that is subinvolution of the uterus. Subinvolution means when the involution is impaired or retarded, it is called subinvolution. In the normal postnatal period or in the normal puerperium, already I have told you that during the pregnancy, the size of the uterus will increase and it will come up to 1 kilogram, and its length also will increase. Actually, the normal uterus is only 60 grams. It will become 1 kilogram, and the normal uterus length is 7.5 centimeter, and it will come up to the level of the xiphoid process of the sternum, and it will come the length will be approximately 30 to 35 36 centimeter during the pregnancy. And immediately after the delivery, if you are assessing the uterus, it will be at or below the level of the umbilicus, and it will be around 13.5 centimeter in length. This 13.5 centimeter is supposed to go back to the normal 7.5 centimeter, and its weight also should go back to 60 grams. And actually, if it is up at the level of umbilicus, means it's an abdominal organ, it has to go to the pelvic cavity and it should become, as normal, it should become a pelvic organ. So this complete process, the size, shape, everything, even physiologically and anatomically, the uterus is going back to the pre-pregnant stage. That process is the involution, and if this process is getting impaired, if it is not occurring effectively, that is known as the subinvolution. I told you that the normal uterus will be having 13.5 centimeter immediately after delivery, and per day, if the involution is occurring properly, 1.25 centimeter reduction will occur in the size of the uterus or in the height of the uterus. And if when you are measuring, if 1.25 centimeter reduction per day, if it is there, means it shows that involution is proper. Now we can see the causes of the subinvolution and predisposing factors. The main reasons or predisposing factors include grand multiparity. In the case of grand multiparous woman, already so many times I have told you that laxity of the muscles will be there. So these laxed uterine muscles will not go back, or it will take time for these muscles to go back to the pre-pregnant stage. So the contraction will not be effective. And another reason is over distension of the uterus due to twin pregnancy or due to polyhydramnios. In this case also, excessive stretching of the muscles will occur, and that may leads to the improper efficiency of the muscles or excessive laxity of the muscles. And another reason is maternal ill health. If the mother is weak, naturally her muscles also will be weak, and the weak muscles will not contract effectively. And next predisposing factor is cesarean section, prolapse uterus, and retroversion of the uterus. Retroversion means, already I have told you that normal uterus will be in an anteverted stage. It is leaning forward. Instead of that, it will go back and it will lean backward. So that process is the retroversion. And if it is retroverted, the tip of the uterus will be inside the pelvic cavity, and it will interfere with the proper contraction of the uterus. And another problem is prolapse uterus. If the uterus is coming down, already we have seen about the prolapse uterus. If it is coming down and if it is entering into the lower genital tract, that is known as a prolapse uterus. So this also will affect the proper contraction or effective contraction. In the case of cesarean, actually we are cutting the muscles and all the layers of the uterus for taking the baby out. So when the muscles are damaged, its contraction capacity also will decrease. And another reason is uterine fibroid. If fibroid is there, means that itself is a space occupying thing, and that will prevent the uterus from going back to the normal 60 gram or 7.5 centimeter. Already we have seen the risk factors or contributing factors for the subinvolution of the uterus, and along with these factors, if the following things are there, means it will aggravate or it will worsen the situation. These things include retained products of conception. That is, if bits of placenta or fetal membrane or something is remaining inside the uterus, that also will interfere with the uterine contraction. And if uterine sepsis or endometritis is there, means that also will interfere with that also will delay the involution of the uterus. The symptoms or clinical features include abnormal or excessive lochia or excessive vaginal discharges, and the duration of vaginal discharges will get prolonged, amount also will increase, and excessive uterine bleeding will be there, and irregularly the lady will get cramping pains, and this pain will be more if the retained products are there, and the lady will get a high temperature if sepsis is there. So the signs and symptoms include signs and symptoms depends on the cause of the subinvolution. The signs include the height of the uterus will be more than that of expected. That is, already I told you that 13.5 centimeter is the normal fundal height immediately after the delivery, and per day it has to reduce 1.25 centimeter, and that reduction will not be there. So it will be more when expected to that particular, what is expected on that particular day. When comparing with that, it will be more. And if you are palpating the uterus, the normal postnatal in the postnatal period, the normal uterus should be hard in nature if it is well contracted, but here it will become boggy and soft in nature. And the features responsible for other features responsible for subinvolution, for example, if infection is there, means signs of infection will be there. If fibroid is there, means you can palpate it, or you can in the MRI or in the scan you can identify the fibroid. Such things also will be there. The management of subinvolution depends on the cause of subinvolution. If the subinvolution is due to endometritis or due to infection, we should start antibiotics. And if it is due to the uterine prolapse, we have to insert a pessary, and you should bring the uterus to the normal position. It will enhance the involution of the uterus. And if it is due to the presence of retained products or bits of placenta, you have to evacuate it by exploring the uterus. And if it is due to the excessive relaxation, you can give ergometrin or you can give oxytocin. This will ensure proper uterine contraction. Thank you for watching this video. Soon we will be meeting with a new video. Thank you.